facing breast cancer surgery and reconstruction now have a new option, and it does not involve implants or more surgery.
Yeah, instead, doctors are using a woman's own fat to gradually rebuild her breasts. And the Fox Medical team's Beth Galvin is here now to tell us how it works. Beth?
And Russ and Portia, the idea is actually pretty simple. They're using liposuction to gather fat from either your abdomen or your backside, and then they purify it and re-inject it layer by layer back into your breast tissue. When in Florida, Michelle Hartog had already had 2 breast surgeries. She didn't want another operation, so she turned to her husband, who had just learned about fat grafting. Florida plastic surgeon Jeffery Hartog had operated on hundreds of patients, but this one was different. She was his wife.
From my perspective, I wanted to do the right thing, what I thought was the best approach.
But Michelle Hartog wasn't opting for cosmetic surgery. Quite the opposite. Her doctor had diagnosed her with breast cancer.
I said, well, what would you do if it were your wife? That's the question I always pose to the doctors.
Michelle had a mastectomy to remove her cancerous breast, then chemo, then months later had another scare involving her remaining breast.
And at this point, I decided I was going to only get breast cancer once. That was the only time I was only going to get that once. So I had a second mastectomy. At that point, I wasn't sure exactly what I was going to do for reconstruction at that point, but I kind of had an idea because my husband was just at that point exploring fat for reconstruction for breasts.
Dr. Hartog had just learned about a new procedure to naturally reconstruct breasts with no implants, just using a woman's own fat.
It was by far the best option in my mind.
If you wanted a quick fix, this is definitely not the way to go. If you want a fix that is relatively complication-free and you don't have to spend a lot of time in the hospital and you want to use your own tissue and not have an implant, then it's perfect. They look really natural. I mean, that's the part that's really amazing. Like when you put on, you know, I ran into somebody not too long ago and they had no idea that I'd been through this.
His wife was his first patient, but Dr. Hartog now frequently does this same procedure for other women who've lost their breasts to cancer.
This is about as close as we can come to replacing a breast.
And the American Society of Plastic Surgeons says fat grafting for breast reconstruction is becoming more and more popular and has a low risk of complications, but it takes time and a commitment on the part of the patient because most women need to come in for a series of grafts before they can get kind of the results that they want.
But what a great alternative, just to know that there's another option for so many women who are dealing with this problem.
Who have already gone through 1 or 2 surgeries, yeah.
Right. The fact that it's your own tissue, I mean, it makes sense if they can make this work on a regular basis.
Yeah. It would be.